Hello students, today I will be taking a class on life cycle of ameloblast. There are six stages in the life cycle of ameloblasts. Going in the order, the first one is the morphogenetic stage, the second one is the organizing or the differentiating stage, then it is the formative or the secretory stage, mineralization or maturative stage, protective stage and desmolytic stage. You could remember it with the eponyms MOF-MPD. MOF-MPD stands for morphogenic stage, organizing stage, formative stage, maturative stage or mineralizing stage, protective stage and desmolytic stage. So, this would be the changes. Why do we have to assign different names to to the same cell? Because it changes itself in terms of size, shape, cellular organelle, staining properties, depending upon what function it is doing at that particular in that particular stage. Hence, we have to assign it and study it differently in order to understand it properly. The first one is the morphogenetic stage. Please concentrate on the title. Morpho means external features, size and shape. Genetic is formation. So, how the size and shape of the crown is established. What is the function of ameloblast? Function of ameloblast is to form enamel. Isn't it? So, this enamel is present where? It is present on the crown of the tooth, right? So we are basically going to learn how the size and shape of enamel is going to be established on the crown, because we know teeth are of different sizes and different shapes inside the oral cavity. So the inner enamel epithelial cells, that is, we are talking about the cap stage now. Inner enamel epithelial cells interact with the adjacent dental papilla so that they can determine the shape of dentino-enamel junction as well as the future crown. So, in the cap stage, the inner enamel epithelial cells will start their interaction with the underlying dental papilla. Inner enamel epithelium is separated from the underlying dental papilla by a delicate basement membrane. Okay, adjacent pulpal layer is cell-free, narrow, and is filled with superficial cells of the pulp. Okay, so light microscopy, we will appreciate these cells. So whenever we talk about the life cycle of a cell, whenever a cell is spoken about, we have to talk about the light microscopic features and the electron microscopic findings of the cells. So under light microscopy, the ameloblast in morphogenetic stage appear as short or columnar cells with a large centrally placed nucleus. So this is how you're going to draw the cells in cap stage, isn't it? Now, in electron microscopically, right now the hurry or the need for formation is not at rise. So there are basically the normal complementary cell organs, just enough for the necessary survival of the cell. So you will see that Golgi apparatus is present, centrioles are present, and they are more towards the proximal side of the cell. Okay, mitochondria is evenly scattered throughout the cytoplasm because it needs to give energy to the functioning of the cell. Terminal bar apparatus. Terminal bars are structures which tends to unite or present between two structures. Like if you have to tie two chairs with each other, we use a rope, right? So terminal bar does that. It tends to hold two cells, two adjacent cells together. So close contact between the cells. This occurs because of thickening of the cell membranes with condensation of the underlying cytoplasm. So this terminal bar apparatus is present at the proximal end of the cell and the distal end of the cell. Hence, they are known as proximal terminal bars and distal terminal bars. In organizing stage or differentiating stage, what organizes what? What differentiates what? We are talking about the cells, the premature cells of ameloblasts. Much before they can become ameloblasts, these cells are known as inner enamel epithelial cells. So the inner enamel epithelial cells interact with the underlying dental papilla and result in the formation or differentiation of odontoblast from the underlying ectomesenchyme. So the connective tissue, the ectomesenchyme present under the developing tooth is known as the dental papilla. So you have enamel organ, you have inner enamel epithelial cells, right? And this is the dental papilla. So they act on the underlying dental papilla, and the dental papilla is made up of undifferentiated ectomesenchymal cells. So there is transformation of this undifferentiated ectomesenchymal cells into a committed cell known as odontoblast. So the function of the odontoblast is to secrete dentin. So the minute you have an odontoblast, it will continue with its function of forming dentin. So the first layer of dentin deposited, the matrix of the dentin deposited is known as predentin. So the basal lamina disappears just before this can happen. Otherwise, what will happen? There will be a layer like there will be constantly a layer that will come in between the enamel and the dentin if the basal lamina remains. But we need to have the hard tissue getting formed one over the other directly. Hence, the delicate basement membrane that was present in the morphogenic stage is going to disappear in this particular stage so that the hard tissues can be deposited over each other. Which is the first hard tissue to be deposited? It is the dentin. No doubts and no confusion. Crown, root, wherever, dentin is the first hard tissue to be formed, followed by enamel in crown and followed by cementum in the root. So with the formation of dentin, the blood supply is cut off from the underlying dental papilla. Hence, the enamel organ collapses with gradual disappearance of stellate reticulum-like cells, reducing the distance between the sac and the inner enamel epithelial cells so that the nutritional supply can be re-established back from the surrounding dental follicle. Cell-free zone in the pulp zone, it disappears due to elongation of the inner enamel epithelial cells. Light microscopy, inner enamel epithelial cells now tend to become longer in size, and the nucleus moves from the central position towards the proximal end of the cell. So it becomes a polarized cell. It's no longer in the center, it is selected an end, thereby making it a polarized cell. So such a cell, which is large in size and with a polarized nucleus, is called as an ameloblast. That's why in the from cap stage to early bell stage. Now we are talking about the events that are occurring in the early bell stage. So there you will call the cells as, no longer call it as inner enamel epithelial cell, you will call them as ameloblast. You need to draw the cells also correspondingly. Microscopically, why did the cell size become larger? Because the organelles inside the cell increased, such as the junctional complexes increases and migrates central to the supranuclear cytoplasm, the Golgi complex. Rough endoplasmic reticulum increases, mitochondria correspondingly increases, mostly in the proximal region, and few scattered throughout the cell. So see over here. Look at the Golgi apparatus just below the nucleus. Look at all the organelles, rough endoplasmic reticulum and all that. Okay, so just such a cell, a tall columnar cell, which has become tall columnar because of increase in the cellular organelles, polarized cell because the nucleus has shifted from the center towards the proximal end of the cell, and all the organelles, other organelle cells after cell tends to move. If this moves proximally, correspondingly the other organelles shift towards the distal end of the cell. So such a cell is now called as an ameloblast. That is in the bell stage. Bell stage, you call them as ameloblasts. So, with the formation of dentin, which occurred in the organizing or this stage, now we move on to the secretory stage or the formative stage. As we are talking about the life cycle of ameloblast, we are talking about the formation of enamel in this particular stage. Formative stage deals with formation of enamel. Dentin is formed prior to enamel, so formation of dentin occurs in the previous step, that is the organizing or differentiating step. No confusions. This is a common viva question. Here you see that it consists of the first layer of enamel that is getting deposited over a layer of dentin, already formed dentin. The first layer of enamel that forms is basically structureless. The structure of the enamel is being thought to called as enamel rods, isn't it? It gives a rod shape or prism shape in old textbooks. Nowadays, we refer the shape as rod. This rod shape to enamel came because of Tom's process, which was extension of the cell processes of ameloblast. So right now when the first layer is formed, there is no extension processes, there is no Tom's process, hence there is no shape to the first layer of enamel deposited and to the last layer of enamel that gets deposited. So usually you get to see that there is only structureless enamel in these regions. So after the first structureless layer of enamel getting deposited, the ameloblast migrate away from the dentin, giving rise to short conical cell extensions which are called Tom's processes. Now Tom's process arises, and from here onwards you get to see the shape of enamel as enamel rods. Distant terminal web is the one that will distinguish between the cell body and Tom's process. It's not so easy. Though in diagrams and all we ask you to draw something like this. Ameloblast, we ask you to draw an ameloblast, and we ask you to draw Tom's process. In our this thing, normally we tend to ask you to draw like this, but in reality it is not like that. You will see that the Tom's process is something like this, cell extension and Tom's process. So you don't know which part is ameloblast cell body and which is the extension process, Tom's process. In order to differentiate, you have to identify the distal terminal web apparatus. So whatever part of the cell comes above the distal terminal process is the cell body, and beyond that is the Tom's process. So deposition, formation of Tom's process. With the formation of Tom's process, now deposition occurs in two different increments. One within the tubules, you have a tubule, and one within the tubule and one around the tubule. So as a result, you get to see the rod shape of the enamel. Light microscopically, you see ameloblasts are tall columnar, whatever they were in the previous stage of organizing stage, they will be retaining the same one. They are tall columnar cells. There is reversal of polarity. There is a hypochromatic nucleus. There is a subnuclear halo formation. Okay, all these things will be present. Increase in volume and content of organelles. Because it's a secreting cell, there is continuous production of increase of cellular organelles. So same thing will be reflected in the electron microscopy. So electron microscopically, you will be able to see that the nucleus, look at this, the nucleus which is placed peripherally will show numerous pores onto its surface. Pores are openings which will allow the nuclear material to move in and out of the nucleus, like mRNA, tRNA. They carry the transcription from the nucleus and move to take it to the different part of the cells. So polarity, and you can see that the chromatin is opened up. All the chromatin threads are opened up so that they can transcribe, and they need to work now, so they need to transcribe. So it's in the open phase of the nucleus. So the codons, the nucleus tends to communicate with the cell, like what has to be formed through its RNA material, mRNA, messenger RNA, rRNA, ribosomal RNA, tRNA or transfer RNA, RER, transcription RNA. Rough endoplasmic reticulum decodes these transcriptions that have been received through the RNA and produces the sequence of amino acids that has been asked for. So sequence of amino acids is nothing but the protein. So the designated protein is going to be produced. Golgi complex. Now, from the rough endoplasmic reticulum, ribosomes present on the rough endoplasmic reticulum produce the proteins that will be later packeted by the closest cellular organelle, that is the Golgi apparatus. It takes it from the cistern phase and passes it through numerous steps. We know Golgi apparatus is a stack of piles of saucers like. So it passes through them. By the time it passes, it is usually packeted. Okay, so the idea of this membrane bound secretory granules, secretory vesicles, is that the secretory products should not get diluted inside the cytoplasm. And second is, cytoplasm also contains calcium. So if the enamel proteins come in contact with the calcium, enamel forms inside the cell, which is not wanted. You want enamel formation to occur outside the cell. So in order to facilitate that, the matrix that is produced is going to be transported as membrane bound vesicles. Golgi complex receives this secretion, condenses, packs it into membrane bound secretory granules, as I just mentioned. These granules migrate from the proximal end, they migrate downwards to the distal end of the cell. Distal end of the cell, that is the place where they need to discharge their contents. As you can see over here, See the cells, the vesicles, these are the vesicles. They come and they bind with the basal layer and discharge the contents. This is the already formed dentin. Dentin is the first formed tissue, right? On top of that, enamel is getting formed. So this is the enamel matrix that is going to be deposited. Only after the matrix is deposited, mineralization can start. Hence, we cannot allow the matrix and the cytoplasm to mix with each other inside the cell. There is going to be a very little time lapse between matrix formation, enamel matrix formation, and mineralization, because unlike dentin, enamel is going to be 30% mineralized immediately. It is thought that the nucleating sites that are present in the dentin, the calcium is taken from these sites by the enamel matrix and they mineralize themselves by 30%. So every layer of enamel that is deposited is pre-mineralized. It is mineralized by 30%. The remainder of 66% of mineralization comes from secondary mineralization, secondary, tertiary, and quaternary mineralization. Crystals which are present in the already mineralized dentin form nucleation site from which the enamel takes up to the crystals to mineralize itself. Tom's process contains. Tom's process, the extension of the cell body of ameloblast, contains or structures such as secretory granules and small vesicles. It doesn't contain rough endoplasmic reticulum, Golgi apparatus, all that. That is not the one that is present. So that is also one of the way of differentiating between the cell body of ameloblast and the Tom's process. Amelogenesis usually lies can be seen inside the lysozymes also. What no matter how much we say that the secretory granules have to be packed and transported to the distal end of the cell, some amount of vesicles tend to rupture. So the minute these are ruptured, they are cleared by the lysozyme, or enamel can form within the cytoplasm, as I mentioned. Some of the amelogenin are destroyed much before it is secreted. Secretory ameloblasts are simultaneously involved with the removal of enamel proteins during secretion. So, for these two reasons. The next stage is the maturative stage or the mineralizing stage. So, unlike deposition, mineralization starts at one particular point. It is usually at the tip of the cusp or tip of the incisal edge. It starts from there and then it sweeps downwards to come till the cervical line. In other parts, like the cervical part of the crown, enamel matrix is still getting deposited. Like microscopy, now that the required thickness of enamel matrix is being deposited, the organelles are no longer required, so the organelles are removed by autophagy. As a result, the size of the cell automatically shrinks, so it becomes a small cell now. There is a reduction in the height and size of the cells. That corresponds to decrease in the volume and the content of the organelles present inside the cell. Excess organelles associated with synthesis are enclosed in autophagic vacuoles and digested by lysosomal enzymes. Okay, remaining organelle usually shift back to the distal part of the cell. Now it's no longer polarized. Okay. The process of mineralization is basically in the form of an alternative burst manner. Okay, there is going to be deposition of minerals. There will be deposition of minerals. There will be simultaneous reabsorption of the excess matrix. Minerals deposited suck back the extra matrix that is present. So on and on and on and on, it continues in that particular manner. In order to do these two functions, the remaining ameloblasts assign themselves and differentiate themselves into two different surface structures. One is a smooth-ended ameloblast, other one is a ruffle-ended ameloblast. See over here, smooth-ended ameloblasts. See, the borders are smooth. Ruffle-ended ameloblast, borders are going to be rough. Okay, so look at this, smooth-ended ameloblast and ruffle-ended or rough-ended ameloblast. Smooth-ended ameloblast, the proximal junctions will be very tight, whereas the distal junctions, distal terminal bars are leaky. Okay, whereas here in the ruffle-ended ameloblast, the proximal junctions will be loose, whereas the distal junctions will be very tight. Okay. Apart from that, ruffle-ended ameloblast is involved in the deposition of inorganic component, that is the calcium and phosphorus, whereas the smooth-ended ameloblasts are involved in the removal of the organic matrix. Hence, the smooth-ended ameloblastic distal complex has to be leaky so that it can take back enamel matrix as much as possible. Protective stage. Now that the whole thickness of required enamel is deposited and mineralized, the crown is ready. Okay, once the crown is ready, it takes quite a few amount of time for it to erupt into the oral cavity. There is a huge time lapse between formation of the crown and its eruption into the oral cavity. Okay, so this time period, the newly formed crown can be in the state of damage and attacked by the surrounding structures. Hence, the newly formed crown needs to be protected. It will be protected by what? It will be protected by a structure known as reduced enamel epithelium. It will protect this, the newly formed crown will be protected from what? From the surrounding dental follicular cells. What will happen if it doesn't protect? If the follicular cells come in contact with the newly formed enamel, newly formed crown, the cells, the follicular cells, once they contact the enamel proteins, differentiate themselves into cementoblast and deposit cementum-like cells. So you will have unnecessary deposition of cementum on the surface of the crown, like we see the overlap type of cementum in the cemento-enamel junction. That is the result of lack of reduced enamel epithelium protecting it over there. Okay, so now the new structure that emerged over here is known as reduced enamel epithelium. As the name suggests, these are the cells that come out of enamel epithelium, that is the enamel organ. There are 4 layers of cells in the enamel organ: ameloblast or the inner enamel epithelial cells or outer enamel epithelial cells, stellate reticulum, and stratum intermedium. So these cells had different sizes and shapes and staining properties and different functions. Now, all these 4 layers of cells become flattened and indistinguishable from each other. Now I cannot make out which is an inner enamel epithelium, which is a stellate reticulum, which is a stratum intermedium, and which is an outer enamel epithelium. So they become, all of them become flat cells, 2 to 3 layers of flat cells. Such cells are known as reduced enamel epithelium. Okay, during completion of enamel maturation, flattened ameloblast cells now secrete the last layer of their matrix, that is thought to be something very similar to the basal lamina. That again is meant for protective purposes. When the tooth erupts, it is called as Nasmyth's membrane, and it continues to protect the newly formed crown from the harsh oral environment. Okay, that is the function of reduced enamel epithelium. So you can observe it over here. This empty space that is present is enamel. Because this is a decal section, the whole enamel is lost, and what you're seeing is called enamel space. So the newly formed enamel, assume this white area to be enamel, and that is surrounded by the reduced enamel epithelium, 2 to 3 layers of flat cells, stratified squamous epithelium. So reduced enamel epithelium, as I mentioned, it is made up of ameloblast, post-functional ameloblasts, or inner enamel epithelial cells, outer enamel epithelium, stellate reticulum, stratum intermedium. Basically all the cells of the enamel organ. So see over here, enamel getting covered by the reduced enamel epithelium. So reduced enamel epithelium, the major function of the reduced enamel epithelium is to protect the newly formed enamel from the surrounding dental follicle cells. If the cells come in contact, if the follicular cells come in contact with the newly formed crown or enamel, they differentiate themselves into cementoblast and form cementum. It is a acellular afibrillar type of cementum. As I mentioned, the overlap, the enamel that we see in the overlap type of CEJ. Or clastic cells may arise and they may resorb or destroy the enamel. So 2 possibilities are there. So the last is the desmolytic stage. Again, the reduced enamel epithelium itself performs this desmolytic stage as well. Desmo bands. What are present as bands? Collagen fibers, collagen bundles are seen. Lytic is lysis or breakdown. So when there is breakdown of collagen fibers or bundles, it is known as desmolytic stage. So this reduced enamel epithelial cells, which are covering the newly formed crown, are going to produce certain lysosomal enzymes so that they can destroy the connective tissue that is present in between the newly formed crown and the oral epithelium. Ultimately, the journey of the tooth is to reach the oral cavity, and there is a hindrance by the connective tissue over here. So this connective tissue is going to be resorbed by the enzymes that are going to be present. So this forms a channel or a tube or a path for the eruption of the tooth. Hence, it is a bloodless process. Okay. In case there is absence of reduced enamel epithelium, the tooth fails to erupt because the pathway is not cleared up so that the tooth can erupt into. So whenever a function of reduced enamel epithelium is asked, the last two stages, that is protective stage as well as desmolytic stage, needs to be considered for the as the functions of reduced enamel epithelium. So in the summary, so what are the 6 stages of life cycle of ameloblast? Morphogenetic stage, organizing stage, formative stage, maturative or mineralizing stage, protective stage, and desmolytic stage. In one word, what happens in morphogenetic stage? The DEJ is established as well as the size and shape of the crown is established in morphogenetic stage. What happens in organizing stage? The inner enamel epithelium cell organize the underlying dental papilla so that they can form odontoblasts. Once odontoblasts are formed, they deposit dentin. With the formation of dentin, the nutrition is cut to the enamel organ, which is re-established back by the dental follicle associated with collapse of enamel organ. So that's the sequelae. Once you know the main events, you will be able to fill in that. Secretory stage is usually meant with the formation and deposition of enamel matrix by the ameloblasts. Maturative stage is the mineralization of a partially mineralized enamel. That is a primarily mineralized enamel, 30% mineralization. That protective stage, the reduced enamel epithelium that forms protects the newly formed crown from the surrounding dental papilla. I've already told you what will happen if it doesn't protect it. Desmolytic stage, lysis of the connective tissue above the newly formed enamel so that a path can be created for the tooth, which is deep seated inside, to move up and erupt into the oral cavity. This reduced enamel epithelium that is formed, usually the fate of reduced enamel epithelium is the newly formed crown as it emerges and comes closer to the oral ectoderm. The reduced enamel epithelium and oral ectoderm fuse with each other and form a solid plug of cells. The tooth is going to pierce through the solid plug of cells and erupt out. Hence, it's a bloodless process because epithelial cells by themselves do not contain vascularization, do not contain blood vessels. So it pierces through the epithelium and erupts into the oral cavity. So again, to show you the diagrams, the stages, summary, please remember the eponym M, O, F, M, P, as I was mentioning, the eponym for the life cycle of ameloblast will be M for morphogenic stage, O for organizing stage, F formative stage, M for mineralization or maturative stage, P for protective stage, and D for desmolytic stage. So M, O, F, M, P, D would be the eponym. Now here I want you to concentrate on the change in the size and the shape of the cell corresponding with increase in the organelles and their positional changes in their position. Distal part of the cell, proximal part of the cell, Tom's process, all that. Okay, so again, one more thing that should be remembered is the life cycle of ameloblasts have to be assigned in the proper order. You cannot say it is morphogenic stage, come to protective stage, go back to organizing stage. It doesn't work like that. You have to follow the order properly because that is the life cycle of ameloblast. Okay, so 6 onwards, see over here, 7, complete a loss of organelles due to autophagy by the lysosomal enzymes. So the cell size shrinks back along with reduction in the organelles. Now look at this, vesicles being transported and discharged onto the distal end of the cell against the newly formed dent, and that is present. Okay, rough-ended ameloblast, smooth-ended ameloblast. Rough-ended ameloblast deposit inorganic material. Smooth-ended ameloblast take back. So that's the shape of the arrows as well. All these pictorial things tend to stay in your mind and it will help you to remember. Thank you.